It's not for, right? This is only for, yeah, so. I'm going to speak loudly. We don't have a lot of time. Thank you for coming to CT Fertility's group. There's a few things about our clinic that I want to be, that I'm proud about. Yeah, this is better. Come over here. That I want to make sure that could you ask them to kind of, yeah, thanks. I will, by a show of hands, are most of you kind of at the beginning of the process? So I want to, because I want to start there. I think that using a clinic that has an egg donation program in-house might be a very important decision that you start to make, because you're seeing there's a lot of people here today, and it's may not be entirely clear to you what each person does. So I want to say that there's a clinic which is run by a doctor. Our clinic is CT Fertility, where our office is in New York City and right north of New York City in Connecticut. We do only egg donation and surrogacy. We do about 300 cycles a year, which sounds really like a lot, but really it's just so highly organized. Half of our patients are international. Most of our patients are same-sex couples or single men. I will introduce today Juan. Teklis is one of our European representatives, and he'll tell you how his role for the international clients that we work with. And what I really want to emphasize is that we can establish with you a remarkably connected, close, communicative relationship through the ways that we communicate, which is by us being here a few times a year at least, Skype, and other ways of speaking, so that it really is necessary and very realistic for you to know that when you start the process, I'm the only doctor in the clinic, so that's good if you want to work with me, because that's who you're going to work with. I have a large egg donation team that works for weeks with each client to give you the egg donor that you're going to desire the most and form the best relationship with. It's very, very unusual to have an anonymous egg donor in our practice, although it's an option. The women, I think many of the girls that donate with me do so because they actually value and cherish the ability to meet at least once the person or people to whom they're donating. You don't have to come to the United States actually very much. It's actually surprising to some people that you can do with Juan's assistance all your testing that you need to do here. I do think there's tremendous value, personal value, as well as medical, for you to come on the week when I'm doing the egg retrieval, taking the eggs from the donor, to give your sperm sample so that I can use a fresh sperm sample to fertilize the eggs. Whether it's one person, one father having all the eggs, or two dads getting half and half. And now a lot of times we're doing actually a third column where we might fertilize 8 eggs with one dad, 8 eggs with another dad, and maybe freeze the other 5 or 6 for situations in which you don't really know what you want to do at some point in the future. You kind of keep those eggs frozen. So we're trying to use as many technologies as we can to maximize the chances of being successful without being wasteful, without creating all these million of extra embryos that you don't actually want or need. So when you come to the US, it could be the first time that you come that we're doing the treatment, you're having some quality time with the egg donor before or after the egg harvesting that I do, and then you can be in the room with me 5 days later when we choose the embryo or the embryos that we're going to transfer. You see them up on the screen of the video that's attached to the camera in the lab. They bring the embryos in, and when I place them into the surrogate, you can be next to her. I mean, these are the kind of things that I don't need you to be there, but I think the experience of it is amazing, and it's the kind of thing that is worth, if in any level possible, arranging your schedules and your flights and coming over at that time. You might visit your surrogate again when she's pregnant. You might not. You would come when the baby or the babies are born. But the actual back and forth inconvenience expense associated with travel, we've really reduced dramatically for a lot of our international clients. And as I said, we're doing more cycles with international clients through our surrogacy program than we are with American clients, because I think the world is opening up. You all know that there's access, and I have such a soft voice. Yeah. So let me have Juan share with you his perspective, or his perspectives, again, from the point of view of being our international team member.
Thank you. Like Dr. Dole said, I am in Europe helping the IPs. I am based in Barcelona, but I help parents from many countries in Europe. And not only I help them with the clinical side of the process, I help them as well with the whole beginning of their journey. There's a lot of information, in a lot of parties involved, and people is quite lost in the beginning. So I direct them also in the right direction. We work very closely with many agencies in the United States, and we can help you with that as well if you haven't got anybody in mind yet. And yes, from Europe, I mean, I have another perspective from here as to the process from the distance, and also the administrative process that is involved, the trips, the organization of your trips there for the clinical side of the process. And like Dr. Law said, we have an in-house donor program, which is very good. We have a very large bank of egg donors, which are recruited in the northeast of the United States, and they pass very thorough screening before they reach us, before they become donors for us. And I assist basically with all along the process, even when the clinical IVF side of the process is over. There's also many questions that I can help with. Thank you.
So I can tell you more about the IVF process if you'd like, or I can answer questions. We can open up. We have a nice small group.
I have a question. Once you sign a contract with an agency, do you have to pay for guaranteed pregnancy, or do you just pay for the treatment?
Well, you're signing there's an agency run by lawyers. Fine. Oh, so in my clinic, no, I don't. You don't sign. If you go to your doctor tomorrow and he tells you you need to remove your appendix, you sign a permission consent form. It has all the information, all the risks. That's what you would sign in for a medical procedure. So it's a little bit different. The surrogacy agency has their own rules. I have several things in my program one that's unique. We guarantee a few things. We guarantee that you get 15 fresh, mature eggs. Most donors will do that. The average number of eggs in my program is actually 18, which I know seems like a lot, but if you're dividing them 9 to 9 and so on and so on, it's actually not always a lot of extra. So if you don't get 15 eggs harvested, you get it. We give you the rest of the eggs either at that time, if they're frozen eggs, or for another cycle. 86% of people get pregnant in my program the first time. So, and it doesn't. You might have 12 eggs. It's very rare to have less than 50. But if you had 12, but you got twins or you got pregnant, then those extra eggs don't matter. But if you didn't get pregnant and you needed more eggs, they would be free. The other thing, really, that's completely unlimited. This is not a guarantee. This is a unlimited program that we have that most people choose. We really just want to get past the cost anxiety. So it includes all of the medical fees and services that you need to do 1 time, 2 times, 3 times, 10 no one's 10 times, but there's no limit. And they're free. There's no more medical expenses in case of failure, in case of miscarriage, in case of whatever. Because it's our way of, we could stand here and say, everybody gets pregnant, but the truth is not everybody gets pregnant every time. And for our job, how we really show who we are is how we manage the people who don't get pregnant and partner with them. It's like flying across the ocean, a smooth flight, easy pie. It's the difficult journeys that differentiate some of the professionals. So our treatment cycles are unlimited, and the newest thing is that they include, at no additional charge, also genetic testing of the embryos, which is traditionally an add-on of a lot, I don't know, $5,000 or $6,000. So our unlimited program includes that as well. Not because I want everyone to do it, because I don't think everyone needs to, but if you feel you need to or want to, it's not going to be another source of anxiety. The idea being, it really is transparent, and when you read it, it's natural to say, but what about, and I'll just say included, but what about, it's included. Everything is included until you have at least one baby. And I feel like that takes away from you the potential and expect a lot of unknown, the anxiety over the unknown, escalating costs can, for some people actually, I would easily understand, be immobilizing. So we were able to just do the technologies and the treatments that are going to empower you to be successful at no additional cost. And if you don't need something, we don't do it. But if you do, it's included.
I understood that we have to go. That we have to go to the clinic to actually give the sperm and to,
Right.
to be tested for a screen. And just very practically, I would like to ask how many times we have to go to the USA.
Right. You have to come to give the sperm. I mean, the truth is, you could. I have clients in Australia and really who ship the sperm. They don't come at all. I would like you to come because I feel like you coming to give the sperm, a little better pregnancy rate, and there's the women. There are all these new women in your life that I feel like you need to honor if you can by being present. So one time, that's it. It's like that 7 to 10 days, but you can come other times and visit and hang out. But yes.
Yes, one trip to the clinic, right? And then, of course, one time when the child is born. So it's 2 trips together, yes, 2 trips together.